Hey, Professor Olford, this is Brandy. I am just recording my video for my tracheostomy. All right, knock, knock, knock. I'm going to shut this door for some privacy and I'm going to do some hand hygiene. Hello, my name is Brandy and I'm just here to do some tracheostomy care for you. Could you tell me your name and date of birth?
Zach Bradden 1101.
Okay, so we do have the right patient per the doctor's orders here and per what he wants us to do today. All right, so are you in any pain right now? Do you have any allergies that I need to know? Okay, perfect. So, like I said, I'm just going to be here to clean your trach out, and we're going to suction along with cleaning the outside of it. Is that okay with you today?
Yep.
Okay. Do you have any questions for me?
Nope.
Okay, well, to get started, I'm just going to raise my patient's bed up to the hip level. So we raise it up. Then we raise it into the Fowler's position as well. So straight up and down to prevent aspiration. Next, we're going to go ahead and we're going to turn our oxygen up. We're going to go ahead and we're going to also take our lungs first before turning the oxygen up. So we're going to listen to all 6 areas of our lungs. So I'm going to have you breathe in and out, 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 in and out. Okay. Perfect. So all 6 areas were nice and clear. There were no obstructions that were heard throughout that. All right. So now we're going to turn that oxygen up all the way to hyperoxygenation, and we're going to get the suctioning process started. So I'm going to wash my hands. I'm going to go ahead and apply my PPE. This would obviously be a mask with a shield or goggles, but I do not have that, so I'm going to say that I would wear that. Next, I'm going to go ahead and get my kit open. All right, and I'm going to take my saline and I'm going to pour it into a sterile basin. Next, I'm going to don my sterile gloves. All right, get that basin over there. And we're going to get with our dominant hand, we're going to coil the suction tubing into our hands, making sure to keep sterile filled the whole time. So now I'm going to go ahead and I'm going to plug my suction catheter in to the wall. So we've got our plug here. Then we're going to crank the suction up between 1 to 120, making sure that it's not too high, causing oxygenation problems. Then I'm going to go ahead and, with my non-dominant hand, I'm going to remove the oxygen mask. And then I'm going to go ahead and, before I insert the tubing, I actually will put it into some saline. Because I'm going to make sure it's nice and moist and that it's going to have no friction going in while suctioning. So then, I'm going to go ahead and, like I said, non-dominant hand, move the mask, our oxygen mask, and we're going to insert it into our trach site slowly until our patient either coughs or we hit a resistance. Once that happens, we're going to pull back just half an inch, then start suctioning. So we'll start suctioning, rotating in a circular motion, and along with making sure not to suction more than 10 to 15 seconds. Pulling back, suctioning, and then we have the suction catheter out. I'm going to place my patient's oxygen mask back on, looking at the O2 stats, making sure that my patient is nice and the stats are not going down from the suctioning. I'm going to clean the tube out with my saline, and then we would repeat that process all over again. And then, since we're done with the suctioning process, I'm going to go ahead and unplug my suction catheter, coil it up here. Then we are going to go ahead and turn our suction off because we are done suctioning. And I'm going to go straight into cleaning and care. So we're going to look at our stoma dressing. We're going to assess the color, the odor, the consistency, and the amount. And I'm going to go ahead and remove that. And we're going to go and we're going to throw away all of the suctioning along with our stoma dressing and our other sterile gloves. All of that into the proper trash receptacle. Next, I'm going to do some hand hygiene. Again, and then I'm going to go ahead and open my tracheostomy cleaning kit, care kit I should say, and we are going to doff up some sterile gloves. Okay, and keeping it sterile filled at all times. Some holes way down at the bottom for some reason. Let's melt it shut. That's why. That's great. Alright, so we're getting that other glove on. Sorry about that. That one little hole was sterile, or was melted shut for me. And then I'm going to get I'm going to use my non-dominant hand. I do have one sterile glove on. You may use my non-dominant hand. And I'm going to soak the gauze and the cotton tip applicators that did actually come in my kit with everything. So I'm just going to put it into my basin in my kit because it's all sterile. And we want to soak that gauze and that cotton tip applicators. Okay. Now I'm going to don up my other sterile glove. Alright, so we have everything donned up. I'm going to go ahead and I'm going to take the old cannula out. So we're going to non-dominant hand. I'm going to move the mask and I'm going to hold the trach steady while I unlock the cannula, the old one, and I'm going to pull it out slowly, making sure that my patient's okay the whole time. You good? Okay, and I have the old cannula. I'm going to go ahead, dispose of that properly, and we're going to grab the new cannula. I'm going to re-hold the trach again with my non-dominant hand. I have a new cannula. I'm going to slide it into the perfect curvature of the trach and lock it into place, making sure that it's nice and secure. So after that, I'm going to take my cotton tip applicators that are soaked in sterile saline in my sterile kit, and I'm going to work inward to outward, making sure moving in a circular motion and cleaning any debris that is around. So we're just going to clean in a circular motion, inward, outward, making sure we clean that thoroughly. After that, I'm going to dispose of that. And I'm going to go ahead and use one of my dry, sterile gauze to dry all of the area around so that there's no skin breakdown. So we're just going to dry everything up, preventing that skin breakdown. All right, so let's go ahead and throw that away. Now I'm going to go ahead and I'm going to place my gauze that actually has the slit in the middle underneath my trach. So I'm going to hold my trach steady while I place the gauze underneath my trach, making sure that everything is nice and secure and cleaned like I did. And now we have that. Next, we're going to go ahead and we're going to place a new tie. Prior to placing a new tie, I will not remove the old tie until this is nice and secure. We will leave that. We will also use a square knot to make sure that this is nice and secure. So we're just going to start on this side. Sorry, this little mass is in the way. Okay, we tie it there, and then I'm going to go around, tie it on the other side, square knots. And I will place 2 fingers to ensure that it's not too tight and we don't have any damage to the skin around the neck. And make sure our patient is nice and comfortable. Okay, so after all of that, I'm going to place that oxygen mask back on. And I'm going to go ahead and I'm going to put our oxygen back on the stats that it was prior to us leaving. I'm going to remove all of my gloves and throw away everything in the proper trash receptacle and taking off all my PPE. Oh, got hot and sweaty. All right, so now we're just going to go ahead. And like I said, we will turn that oxygen back to the prior settings before leaving. We don't want to leave it on that hyper oxygenation. Okay, so then we're going to auscultate all 6 areas of our lungs again. So breathe in and out. Breathe in and out. In and out. Perfect. Thank you. Okay. Bilaterally, all of our lung sounds are clear. No signs of obstruction there. So I'm going to go ahead and perform some hand hygiene as well before or after I take off my gloves and everything. But so now we're just going to go ahead. We're done with everything. So I'm going to put those rails up, lower that bed all the way down, make sure a patient is comfortable. Are you in a good position?
Mm-hmm.
And make sure the bed is locked. I will give the call light to ensure that they could call us if they need it. Okay, so you're good? Are you comfortable? Do you need anything?
Happy, copacetic.
Okay, are you in any pain?
No.
Okay, well, thank you for your time and your patience. I appreciate you. Okay,
Thank you.
hand hygiene, and we're leaving the room.